In this segment, we'll demonstrate the counterstrain technique for an anterior lumbar AL3 and AL4 tender point. Now, the AL3 tender point is found just lateral to the inferior iliac spine. So we find the anterior superior iliac spine, move down to where the anterior inferior iliac spine is, and then probe from lateral to medial to elicit the tender point response. So we probe first on the left, and we don't feel any tissue tension or anything, but when we start to, we get that tender point response. So that would be the anterior lumbar AL3 point. The AL4 tender point is inferior to the anterior inferior iliac spine, and we're going to probe from inferior to superior to elicit that tender point response. So we quantify that as a 10, and again we have to have our patient totally relax. We're going to take the patient up. I'm going to flex the hips and knees to the level. In this case, if I'm palpating the AL3 point, just lateral to the anterior inferior iliac spine, we're going to do flex, and in this case it usually requires anywhere from maybe 60 up to 90 degrees. You should feel the tissue softening under your fingers. It will require the knees and hips to come toward me, which will rotate the upper of the segments to the same side, and then we're going to take the feet and ankles away. So the classic position would be flexion, side bending away, and rotating toward by bringing the knees and pelvis toward me. So for an AL3 or an AL4, this would require flexion, side bending away, and rotation toward. Now typically these points could be clinically associated with the lateral border of the iliacus muscle, as well as myofascial structures innervated by either the L3 nerve root or the L4 nerve root. After our 90 seconds is up, we're going to slowly reposition back to neutral. Let those patients relax, drop the feet, and then, of course, reassess. Hopefully the patient says the pain is 0 or at least 70% reduced from the original tenderness.